Today, we are going to go over how to do postural drainage and breathing on the left lower lateral segment, as well as lower lobes and superior segment. Before you start with any tapotement and drainage, you should instruct your patient how to do lateral basal expansion, which is a breathing technique. The therapist should place their hands on the lower aspect of both sides of the rib cage, instructing the patient to exhale while they do so, pressing down and in using pressure from the palm of their hands. This can be progressed to a sitting position where the patient can perform the exercise on their own. Lateral basal expansion can also be performed individually without assistance. You should instruct the patient to have the sheet wrapped around the lower aspect of their ribs. They will exhale, and at the end of that exhale, they will pull the sheet tight, providing the down and in pressure, and then release to inhale. These breathing techniques should be performed 3 to 4 times, and a rest period should be performed before any tapotement to prevent hyperventilation. Next, we are going to perform postural drainage of the lower lobes, the left lateral segment. To do this, the patient needs to be positioned with their head down at 30 to 45 degrees. We have this bed at 15 degrees to give you an idea of what type of angle it should look like. The therapist should be using a cupped hand position, which you will see Danny doing. He will be using an alternating rhythmic pattern. His elbows, wrist, and shoulders should be loose, and this should not be uncomfortable for the patient. He is going to be performing this alternating rhythmic cupping action on the lower aspect of the patient's rib cage. To perform postural drainage of the lower lobe, right lateral segment, the patient should be positioned with their right side up, and the same cupping action would be performed by the therapist. Now we are going to do postural drainage for the lower lobe's superior segment. To do this, your patient should be positioned prone with pillows under their abdomen and their back flat. The therapist will use the same cupped hands and the clapping motion on the lower part of the inferior angle of the scapula, alternating on each side. Keep in mind that vibration is used in conjunction with percussion to help move secretions to larger airways. The therapist should only use this maneuver during the expiratory phase, followed by a productive and effective cough from patient to allow secretions to be expelled.